workshop on giving effective feedback, as well as another workshop on assessment and evaluation of residents.
I did a workshop on assessment and evaluation of trainees given by Dr. Eric Holmboe from the American Board of Internal Medicine.
I recently attended a course organized by the core faculty development, and it was on evaluation of residents.
I think these are very useful workshops. I've been applying what I learned in these workshops to my interactions with my students as well as residents. I've come to realize that the younger generation of students as well as residents grew up in a very different educational environment from us, and it's important for us to keep up to date with the rapidly developing field of medical education so that we can be more effective teachers.
At Duke-NUS, teaching the undergraduate medical students, and we spend a lot of time observing the students, doing interviews with real patients, but also with standardized patients who are healthy people trained to play the role of patients. And we, as faculty, give direct feedback to them. And one of the things that I learned that I was able to bring back to Duke-NUS was these skills of giving good, effective feedback. So Dr. Holmboe has a number of validated ways of giving feedback to students in a way that's going to be able to help them improve their performance. So I was able to bring that back to Duke-NUS and train my co-faculty.
This course was interesting because it gave us a lot of pointers on not just how to evaluate, as well as to really properly assess these residents. While we have done this quite well so far, what this course essentially has done is to conceptualize, as well as packaging all these things into a much more objective way of assessing the residents as well as students.
Some suggestions may include how to use information technology for medical education to create a more interactive environment for our students. Other suggestions include teaching us how to do medical education research, as well as how to teach our residents to teach.
For me, the thing that I'd most like to see the center do is some more workshops on communication skills. For me, communication skills, I think, are at the heart of the doctor-patient interaction, and we spend a lot of time teaching the students at Duke-NUS how to communicate effectively. I know that's going to be a big push in the residencies as well, as to develop competencies in communication. Good communication with patients is real benefit to everybody. Patient outcomes are better, doctors are more satisfied, and I think giving our students and trainees the skills to communicate effectively is going to be really important for them to be successful. And I think having, whether outside people come in or even Singaporeans who know more about communication skills, teach everyone else, I think it would be a nice way to share information.
I think one of the more important areas that I hope that the center would organize includes communication classes. And I think this benefits not just as faculty itself, it will really improve a relationship between doctors among themselves, doctors with the students and residents, as well as students with the allied health people like the nursing staff, etc., and all the other support staff. And really, when you improve communication, it really reduces the misunderstanding rates, and hopefully brings down the complaints rates as well.